Thank you all for coming today. My name is Carrie Sager. I'm the Homelessness Program Coordinator for Marin County Health and Human Services.
And I'm Ashley Hart-McIntyre, Homelessness Policy Analyst for Marin County Health and Human Services. For your information, a list of speakers will be available for spelling.
Every 2 years, communities across the United States conduct a count of people experiencing homelessness on a single day in January. Marin's point-in-time count took place early in the morning on January 28th of this year, when teams fanned out across Marin to gather data about people experiencing homelessness on a single day. The results are used to understand local needs, track progress towards the goal of ending homelessness, and evaluate homelessness reduction strategies.
Over the past 2 years, much of our systemic effort has been focused on people experiencing chronic homelessness, those who have been homeless for more than 1 year with a disability that would make it difficult for them to maintain independent housing. The numbers we released today will demonstrate the impact of that focus.
We will not have final numbers until we release our complete report in July of this year, which will also contain additional information about the people experiencing homelessness in Marin. However, we're pleased to share these preliminary numbers with you today, and we do not expect these numbers to change in the final report.
Today you will hear from 4 speakers, and then we will take questions. Here to present the preliminary numbers is Marin County Supervisor Katie Rice.
Good morning. So we are really proud to announce today that there are 102 fewer individuals experiencing chronic homelessness today in Marin than there were in 2017. That is 28% fewer than just 2 years ago. This data shows that we are on the right track and that it's indeed possible to end chronic homelessness. Hence our goal to end homelessness, chronic homelessness, by the end of 2020. The count also showed that we have 7% fewer individuals experiencing homelessness overall. Family homelessness is down by 28% and youth homelessness by 16%. Our success here in Marin County is the result of a joint commitment on the part of the county and all of our partners working together to serve our highest need, most vulnerable community members. We're able to connect these individuals to permanent housing through a major systems transformation. We're focusing on the unique needs and circumstance of each individual. We credit this success to the commitment of our county staff, the hard work of our nonprofit partners, the adoption by all of the Housing First approach, and the implementation of Marin County's Whole Person Care program. People who experience chronic homelessness have a life expectancy 25 years less than that of their housed neighbors. A commitment to housing people experiencing chronic homelessness is a commitment to saving lives. The cost of leaving a chronically homeless person on the streets is roughly $60,000 per year due to the high cost of hospitals, the court system, criminal justice, and other public systems. The cost of providing permanent supportive housing for people who are chronically homeless is roughly $25,000 a year. So with that, I'd like to turn it over to Supervisor Damon Connolly for a little bit more on the program.
Thank you, Katie. Good morning, everyone. Marin County is honored to be a leader in the effort to end chronic homelessness in our community. We and our community and partners, including the City of San Rafael, are committed to find permanent housing solutions for the most vulnerable chronically homeless residents in our community, and the results are showing. In 2016, the Board of Supervisors adopted Housing First as the official policy of the County of Marin. Housing First is an evidence-based practice recognized as a leading model to address homelessness both regionally and nationally that places people experiencing homelessness in housing first and foremost, then wraps them in the support they need to stay there. Studies in diverse communities across the country have demonstrated that Housing First is an effective, cost-saving model. With today's news, we are celebrating the success of that bold policy decision. Since the most effective solution to homelessness is housing, we've worked to increase the number of permanent supportive housing beds for people experiencing chronic homelessness in Marin. In 2017, Marin County Health and Human Services began partnering with Marin Housing Authority to offer up to 50 new permanent supportive housing beds per year through the pairing of Section 8 vouchers with whole person care and behavioral health services. Marin County is proud of our collaboration with our nonprofit partners. With their help, Marin County supports 190 emergency shelter beds, 206 permanent supportive housing beds, and more than 20 programs serving people experiencing homelessness. Getting these clients into homes is the start of the journey in a housing first model. It's worth noting that since the inception of coordinated entry in Marin in October 2017, the program has resulted in 128 chronically homeless individuals being housed. And through implementation of coordinated entry, which is a new system that facilitates real-time communication among partners, providers are able to coordinate care for clients across disciplines, successfully assisting these clients to maintain stable housing and improve their health and well-being. Thank you.
Our next speaker is Christine Paquette from St. Vincent de Paul.
Hello everyone, it's an honor to be here with you this morning and with our collaborative partners behind me. I've been asked to speak on behalf of the community-based organizations that have worked so hard to achieve some of these successes, and that is St. Vincent de Paul Society, Ritter Center, Homeward Bound, Buckaloo Services, and many others. So when we started out with this goal of decreasing chronic homelessness, it was very much about seeing people on the street for many, many years, sometimes decades, that needed tremendous support with mental health services, addiction services, and with physical disabilities. And I will say that one thing that all the CBOs had in common was that we were discouraged and upset, but we didn't have a plan. And by working together collaboratively through our homeless outreach team and through our coordinated entry program with the Marin Housing Authority, we have taken each person one by one. We have our list of the most vulnerable people, and we sit in a room and we say no one's leaving until we figure out a plan for this person. And it's been amazing work, really difficult and challenging work, but when we have a day like today where we can look at these numbers and know that it's really working, and as Katie Rice said, that we are literally saving lives, it's really rewarding. And I'm just here to thank all of you who are here and all of you that have had such an important part of the success. Thank you.
Our next speaker from Marin General Hospital is Lee Burns.
Good morning, thank you. I'm Lee Burns. I am the manager for the Prime Project and the brand new FEMA Supportive Care Center. The Prime Project is a Marin General Hospital program that is it's the sister waiver to whole person care. So we're both in the Medi-Cal 2020 demonstration. So both of these projects aim at innovative ways at improving the system of care for our most vulnerable individuals to make sure it's equitable, seamless, and really person-centered. So that's the brief background about our involvement. Marin General Hospital is absolutely thrilled to be partnering with all of these individuals. It's incredible to see that these results are beginning to come out and they're showing a positive impact of all the interventions that we've created so far. In any population health project, it's imperative that you have cross-sector partnerships, otherwise you will not be successful. So looking at this together, finding solutions together is really something that was a no-brainer. So at the hospital, it was an easy yes to be the partner. Anecdotally, we're beginning to see results in our utilization, and we still have yet to substantiate that with data. Now that this piece of information has come out, we're going to be looking deeper into with data science and analytics to be able to see what the impact on our utilization has been. But anecdotally, absolutely, teams across the hospital are beginning to see some results from this coordinated approach. So the last part I wanted to say was really just in modern healthcare right now, you have to think about a person as the whole person and all of the factors that influence their care, not just in that brief episode, in that moment when you see them. And that's what we really call trauma-informed care, housing first, social determinants of health. So our care is shifting to be more focused on individuals and their needs that prevent them from accessing or engaging in their health care. So this partnership that we all have, connecting medical, social services, community-based organizations, everybody in the county, really is honoring that evidence-based approach of looking at the individual and their needs, and not writing someone off simply because they're not coming to their appointments. So thank you, and thank you very much. Appreciate being here.
Thank you to our speakers. At this time, we'll accept questions.
I have several questions. My first question, I guess, is to Lee Burns. I know that there was someone from County Health and Human Services that spoke to the Marin Healthcare District Board recently. Lee Domenico has expressed some concern about the fact that Marin General shoulders the greater burden of taking care of indigent care through the emergency healthcare system in Marin. And I guess there were some numbers at that presentation about, at least some preliminary numbers on what you're seeing in terms of reductions due to the homeless programs. You know what I'm talking about? And you know what those numbers were?
So the question for Lee was whether she knows the numbers, any specific numbers about reductions that Marin General is seeing. And Ken Shapiro from Marin County Health and Human Services is going to tell us those numbers.
I was one of the individuals who presented to the healthcare district that evening. Some of the numbers that we presented there were the reductions that we saw for the people we had engaged in intensive case management services with whole person care between January and June of 2018. And I'll give you the exact numbers, but I believe it was a 38% reduction in their utilization of emergency departments during that time, and a 44% reduction in their inpatient hospitalizations during that time. Those are our preliminary data for those who were receiving intensive case management services through whole person care. Those case management services are provided by these community partners you see here: Homeward Bound, Ritter, Downtown Streets Team, and St. Vincent de Paul Society.
I had another question. My understanding that a lot of the care that's being, a lot of people being housed, a very high percentage, maybe, I don't know, 90%, are being housed through using housing vouchers. And I'm just wondering if you expect that the availability of those vouchers to continue. I believe there was a period where you had to slow down housing people because they weren't available, but now they've become available again. So I'm just wondering what you see as the availability of those vouchers. And then also, in terms of the supportive housing costs, if you're at all concerned about, looking into the future, if the money isn't there to continue the supportive housing aspect, if those people that have been housed might fall back into homelessness if they no longer afford those services.
So it was a two-part question. The first part was about how, whether we're going to continue to see vouchers be available for placing people in permanent housing. For that question, I'm going to defer to Kimberly Carroll from the Housing Authority.
Hello. You know, the vouchers are always going to be an issue. We are dedicating to put 50 chronically homeless individuals onto our closed wait list every year. However, that does not mean that we'll be able to pull people off of them every year, because there is a finite number of vouchers that will be available and funds that are available to Marin County through those vouchers. So we are coming very close again, where we may have to do a slowdown on issuing vouchers because of the federal dollars. We at the Housing Authority have done a rent study which increased our fair market rents here in Marin County, which did give us more dollars in Marin. But even that, it's the cost of rents are so high here. So the vouchers cannot be the full solution to this problem, but it is a big piece of the puzzle.
And just to add, we've also added new vouchers to our system of care that are not the Section 8 vouchers. So we hope that additional vouchers will become available that way, through the Section 811 program, through HUD, additional HUD-VASH vouchers, which is supportive housing for veterans. So we're always keeping our eyes open for additional types of housing vouchers. The second half of the question was about sustainable funding for the supportive services that are keeping people in housing. And I'm going to turn that question over to Ashley Hart-McIntyre from Marin County.
So I wanted to also mention the press release that we put out a couple of weeks ago about more than almost $5 million in new funding coming into Marin for permanent supportive housing. And that is brand new money from the state that's going to, in large part, support the new redevelopment of the Mill Street program in San Rafael that will provide stable supportive housing for people who are experiencing chronic homelessness, who have very high needs. And because of, as Carrie mentioned, because of the many systemic changes that we've made, we're very competitive for new dollars. Some of the new vouchers that we brought in were brought in on a competitive basis. Those were 28, they're called mainstream Section 811 vouchers that the Housing Authority applied for. Those were competitive, and we anticipate being competitive for those and similar other housing funding sources in the future.
Are those federal vouchers you're talking about?
Those are federal vouchers, but the state has been increasing their role in our system of care as well.
I just want to jump in on that too. Those mainstream vouchers, we received 28 of them in Marin County, and part of the requirement is that we have 80% of them utilized by the time the next NOFA comes out. And I just want to take this moment that as this team, we just got those vouchers issued, and we've already housed 18 people out of the 28. Chronically homeless, disabled folks, the non-elderly folks is who those vouchers are aimed at. So we will be able to be really competitive for the next round. And I see that a lot of my peers in the housing authorities are giving them back because they can't get them utilized. So the only reason we were able to utilize them is because I've got all these folks behind us doing it.
Additional questions?
I'll come up with one more.
Sure.
Actually, give somebody else a chance.
Maybe you can tell us about Marin County's efforts with landlords here in Marin over the past 3 years, and how we've convinced them to give Section 8 opportunities to some of our low-income clients for instant housing.
So the question is how we get landlords to accept Section 8 housing choice vouchers, and I will also turn that question over to Kimberly Carroll.
So we have done an incredible job with the help of the county, specifically Supervisor Damon Connolly. About 4 years ago, we created the Landlord Partnership Program, where we were able to have money to pay for security deposits and vacancy losses and damages, and that has we've brought on over almost 170 new landlords to our program over the course of the time. We're able to get landlords to stay with us because of this landlord partnership program. It's been an incredible game changer in the work we're doing. We also, through the county, we're getting funds for a housing locator. So we have a housing locator who has years of experience in the property management world, and she's able to really speak landlord language and help us really convince landlords to take Section 8, to take some of these really hard clients that we're working with, and it's been a real big change. So and I've been working at the Housing Authority for almost 19 years, and I'm telling you, it is a whole different game today than it was 3 years ago. 4 years ago, we were actually leaving money on the table, and today we're utilizing all those funds because we've got landlords that are willing to partner with us.
Other questions?
I know you have a goal of ending chronic homelessness by the end of 2020.
2022 is the goal.
And there's a goal to end homeless veterans.
Also 2022, yes. The goal to end veteran and chronic homelessness by 2022.
Can the preliminary numbers tell us how we're doing with veterans at all?
We're not going to have the veteran numbers until the final report comes out in July.
So no preliminary numbers?
No, not for veterans.
Okay. And then regarding those goals, a skeptic might look at the numbers today and say, well, maybe this just reflects the general improvement in the economy. Is there any way to know that that isn't the case, and if the economy, we go into recession later this year or early next year, the numbers might just start to rise again?
So the question was, is it possible these numbers just reflect an improvement in the economy, and these numbers could begin to rise again if the economy starts to be not as strong? And I'm going to turn that question over to Ashley Hart-McIntyre as well.
Well, we're thrilled that the economy has improved over the last several years. We have also seen housing costs continue to rise. I believe it was a 3.8% rise in Marin in 2018. And despite that rise in housing costs, we're seeing reductions in chronic homelessness. Also, for the population that we're really focused on, those 128 chronically homeless individuals that we've successfully housed in the last 18 months, those are folks who are less likely to be positively impacted by a booming economy. Those are folks who are less likely to be able to hold down a job, for example. And there are several other communities across California, and I'm sorry, I don't remember which ones they are off the top of my head, that have released some preliminary point-in-time count numbers indicating that their homelessness rates have gone up.
Any other questions? Yes.
Can you please expand upon the different types and numbers of services in place which are addressing the behavioral health issues of the chronically homeless in Marin County?
So the question was about the services that are available for people with behavioral health issues. I'm going to turn that question over to Amit Rajparia with Marin County Behavioral Health and Recovery Services.
Hi. Good morning. So so the question was about kind of the sorts of behavioral health services. So we have particular programs that are very targeted towards kind of homeless and homeless vulnerables. So one of those is a kind of wraparound behavioral health, what we call full service partnership, which is the Odyssey program. What's been really exciting is, as of February of this year, we've launched kind of a brand new full service partnership team called the Impact Team. That really is now kind of our highest press team that is also connected with our AOT program. So AOT, assisted outpatient therapy, is kind of a small component of that, but our Impact program, we're already up to about 20 clients that we're serving, many of whom are overlapping with these services. And that really is a team that can be out seeing clients, if need be, every day. in some cases for brief periods of time. The other, I would say, the other new things that are coming on board this year or over the next few months is just our kind of front door. So our access services, which is kind of our single point of access for people to get into services. One of the things that we've done is open that up to walk-in hours, and that's something over the last year that has really allowed people to access those services in a more kind of consumer-friendly way. But the kind of feedback that we've consistently gotten is for people who just cannot even get to that front door. And so we're excited that there's actually two different avenues that we're going to be addressing that. One is a brand new kind of health navigator position, which will be part of our access team. So somebody who's certified to do those intake assessments and can be going out into the community to do that. In addition, we have funding for a program that's going to be contracted through the Buckaloo services for two other individuals to actually be focused on the homeless population and engaging, and then at the same time being certified to do those sorts of access assessments. So that's a bit of what's going on. I think there's so many programs that we have that kind of touch and overlap with this population, but that's what I would say in terms of new things.
Good morning, my name is Mark Shotwell and I'm with Ritter Center, and just in addition to what Amit said, the county also, and I've worked in other counties and I think it's very innovative that they have a team of recovery coaches that work with people who have substance use disorders or co-occurring substance use disorders along with their mental illness. And those counselors stay with people, those recovery coaches stay with people whether they're in treatment programs or not, over multiple treatment episodes. They're so collaborative with the case management teams that we operate. It's just an absolute boon for clients to be able to have that kind of support. And there's also been a big effort to have substance abuse programs across the county really embrace the full stages of change that people are in. So when people are in pre-contemplation or contemplation around recovery, often recovery programs are looking for people who are already committed to abstinence. Unfortunately, a lot of people die before they get to that place if they don't get support. So the innovations in the county to have substance abuse programs embedded in homeless shelters and really embracing a harm reduction model. So that if you're interested in just exploring your addiction, just learning more, you're welcome to come.
Other questions? Okay, so I'd like to thank everybody for coming out, and this concludes our press conference. Thank you.